Hello everyone. Today we're going to talk about what are the different types of procedures that endodontists have to use to take care of your teeth and save them. And I wanted to thank, first of all, to my great assistant, Amanda Palma, because she prepared an amazing script for the show. And why she did it is because we're trying to simplify, and I want somebody to give me, that work with us, and especially her that's doing her specialty in endodontics, assisting me, what is what she see that the patient understands about having a root canal. And after a year working with me, I was in shock, and I'm very happy what she wrote, because it is true. You are sitting at the dentist and your dentist said, oh my God, your gum is inflamed, you have an abscess, and now you are gonna need a root canal. And I have a patient that she was crying because she never had a problem until they told her she needed a root canal. And I said, the root canal is not cancer, you are not gonna die. A root canal is to help you to save your tooth. What we do is the removal of the nerve, that is, it's called nerve. The patient will say, this is a nerve, and the nerve is not only the nerve, it's what you have exactly in this area. But this is heart, this is dentin, and this is the nerve. Was a nerve, an artery, and a vessel. These nerves are very important because they're connected to the trigeminal nerve of your brain, the fifth canal. So now, you're in the dentist and then he said you needed the root canal. What he means is your nerve has been affected, your vascular system is affected, and now we need to get in, like you saw in the video, make a space, find the canals, measure them, let the infection drain or get out, irrigate, and finish. I have another video where I talk especially the step by step. But in this case, it's more in general, what you as a patient, how do you know you're gonna need a root canal? So in this situation that we have this patient here, he has a big abscess in this area. It's hard to see here, but when you go to this part where he has, I said, let's touch a little bit this area. Look what I found. A pus, this green part that you see here is the pus. Before this red came a huge amount of green liquid, and I love it because I know once, this is like a pimple. Once you press and it comes out all green, the infection starts to get out. In that moment, the pain went away completely. So if you're having an abscess that is ready to explode and you are not close to a dentist, you're not close to an endodontist, please be sure to remember this advice. Press yourself around, and if you have anything to poke it, because the most important part is that you drain that abscess. Then in the office, the advantage that we have is that we have this fistula that you go inside of the area of the abscess or the pimple, like the patient call it, and you drain it. And we don't have to open a big incision. In the old times, we have to open a big incision here and then let the infection come with the big suctions that we have. But in today's technology, having microscopic surgery, I do microscopic endodontics, so microsurgery. And for many of the steps that we do now, the companies have developed instruments that are so small because we can see them on the microscope that we have at the office. So with the small suction, I will say, but this is like it's a pipette, and you insert and we insert it in the area because it's so ready to get out that a little push-up is gonna come. So we were there draining for a while, this patient, until he was completely out of the inflammation in this part. But after that, we have to open the tooth. And what happened when we open the tooth? When we start opening the tooth, we find that he has a huge fracture on the tooth. So having the fracture, I said to him when I opened this space, you know what is going to happen is that you are going to have an extraction of this tooth because this infection is going to come back. But we wait a couple of months and he is fine, and he knows he is an extremely busy person, and he knows that he's going to need to have an extraction. There can be times where the dentist said to you, you know what, you need a root canal, you have a big infection, but now you start the root canal and the canal is calcified. What do you do at that moment when the canal is calcified? My chairman in Mexico, before I came to USC, used to say, breathe, and if you go crazy, take a pill of patience, just to say meditate before you start, because you have to spend an amazing amount of time at USC. The chairman at that time teaches that to don't spend more than 15 minutes if the canal is calcified, and we go straight to do surgery. However, I always think the patient is like, what about if I'm the patient? I don't want to have surgery because my endodontist doesn't want to spend more time with me, of course, because, it's time consuming. But my office is extremely, extremely personalized. And in this treatment, the patient had, if you see, I'm going to show you that. Amanda, make me a favor to open not the whole tooth. I wish I have the one where the patient started. But look at the infection here doesn't look too much, but this is when I was able to bypass the calcification. But when you see the first x-ray, when the patient first came in to see me, the patient was having this infection, and I asked her, do you have any pain? No, because also it was draining. So when I started her treatment, she was very satisfied knowing that we were going to save the tooth. And we spent a couple of hours, but look at this image when I was very excited. Unfortunately, you have to destroy more part of the walls of the tooth, but this is just more technology. But for you is to know that it could be times that you get to the endodontist and then you're going to have a calcification on the tooth, and that calcification is going to take a lot of time, because if you don't, in this case, that the tooth is infected, you don't disinfect everything, and you go, and I love the results. She was very satisfied. She's very happy. We saw her recently. I don't have an x-ray to show you right now, but this black area that is here has disappeared. We follow every 6 months at the office this type of patients, because then you don't know what can happen with time, and I like to know what is happening through the time with the treatment that we did at the office. So just know that it's not the end of the world. Your dentist will send you. When you come to the endodontist, we're gonna do different testing: cold, hot, sweet. We don't do the sweet test, but we do biting. We check the gums. We check the cold. Like when we have the cold test, is with this small device that it has a circle also covering. I don't know why you don't have something different yet, but the ice is the dry ice goes all over in this container, and then we start pressing. The ice start coming, and we start going tooth by tooth. So if you have it in one tooth, you place it. They're gonna place it here, and then you're gonna say, I have pain. But listen to this. I'm gonna give you this tip. If the pain with cold disappears immediately, that is not a root canal. But if they place the cold and the pain is, even if it's not that much, but the pain is like, oh my God, it hurts, and it stays for a longer period of time, which is a lingering, we call it lingering, means that it's staying, and the patient said, oh, it's still there, it's going down, a little. That is a national board exam for us in the United States, because that is a root canal. If the pain is spontaneous, that means that it's not caused by anything else. It's not caused by cold, but by sweets, by hot. But all of a sudden, it's like the patient said, oh my God, I have pain. That is a root canal. Listen to another advice that if you're grinding your teeth, you can wake up with an amazing pain on the tooth. And we're going to touch about this topic in another episode, what is called refer pain. And you have so much pain in that tooth, but when you go to your dentist, if your dentist realizes you're grinding, he's going to put you in a night guard because I'm sure you didn't wear your night guard or you're not wearing a night guard. But in case the dentist send you to the endodontist to be sure, just remember they have to do the test of cold in all the teeth to compare to the one that you have in pain. They have to do the test of biting, which is with this. I have shorts episodes in YouTube where you see the biting test and you go tooth by tooth and you go, do you have pain? No. You have pain? Oh my God, it hurts. If the pain is so sharp when you bite and it's like, oh my God, it's so painful, even if it doesn't linger, that means that you possibly have a crack or a fracture, which is another topic that we will talk. And I have another episode actually on cracks. It's called the crack tooth syndrome. You can look at it on the YouTube channel. And also we have to measure with this periodontal device. It's a perioprobing, and we start measuring the gums of one tooth after the other and see if this goes all the way inside. Like in this case, if when I did a probing, I would have this going all the way inside, it will be a 80% possibility that it can be a crack or a root fracture. And to confirm, and you don't see it, then they're gonna send you to have a CT scan. So not everything is X-ray. So diagnosis is not only an X-ray, because if there's a patient, if I send you my X-ray, can you give me the diagnosis? I am really very strong knowledge. I have a very strong knowledge in diagnosis, but I'm not a magician. I need to see the patient in person, and that's what your endodontist should do. There's certain things that you can do, like now I can do a consultation with my patients on FaceTime. If any one of you wanted to call to the office and have a consultation on FaceTime, I will be happy to help you and teach you, and we can communicate and I can hear your symptoms. However, that is another different story. But I want you to know that the purpose of this episode, that it was an excellent script made by Amanda. Sometimes I go to different topics, right? But because it's fascinating to know what are the different things that can happen at the office when you're going to have a root canal. It could be sometimes that you're coming so nervous that if you don't tell the endodontist, you can faint. Or if you come with a food with a lot of pain, you can faint. And for us, it's a lot of time that we have to spend to bring you back and get you out of pain. So don't be afraid. Go to see your dentist every 6 months. Brush and floss at night. And maybe you will never need a root canal. But if you're grinding your teeth and if you look at the mirror and you said, oh my God, I have different cracks and fissures on the tooth, then you have to be worried about using a night guard. For that, you go to your dentist. So we wanted to prevent, that's why we wanted to do this show, is to prevent that you have decay, that you need a root canal, that you lose your tooth, and now you need an implant, and then you need an implant crown, and then if you don't take care of your teeth by brushing and flossing, then you're gonna need a denture, and then you're gonna need to have all the teeth extracted. So I hope you liked the episode. If you have any questions, please be sure to write in the comment area or send us an Instagram or TikTok. Thank you.